Hello, our presentation will answer the question, should patients be able to choose their own care, using the films The Father and A Beautiful Mind as case studies. The primary theme when determining whether patients should decide their own care is autonomy. So first, let's discuss autonomy, capacity, informed consent, and relevant legislation.
So, autonomy is defined as the right of adults with capacity to make informed decisions about their own medical care. Professionals should always seek consent or informed agreement before proceeding with any treatment plan. The law states that an adult patient with no mental incapacity has the absolute right to choose whether to consent to treatment. Even if the decision appears irrational to others, autonomy governs treatment as long as the patient has capacity. However, two conditions must be met. So the individual must have relevant internal capacities and they must be free from external constraints, meaning that they're not coerced into a decision. An exception exists where a person's autonomy can be overridden, which is the Mental Health Act 1983. This legislation allows for compulsory detention and treatment without consent if a person has been assessed and determined to lack capacity. While designed to protect the patient and public, it limits autonomy and has been criticised for being too restrictive in recent years. Capacity refers to an individual's ability to use and understand information, make a decision, and communicate it. Mental health conditions such as Alzheimer's and schizophrenia, which we'll discuss in this presentation, can impair a person's ability to process information and make informed decisions. So, in both films, it can be argued that the main characters lack capacity due to their conditions, but Section 23 of the Mental Health Act refers to the nearest relative having certain rights. So, in the films, this is John's wife Alicia and Anthony's daughter. Whilst this can be beneficial as they may know the patient's best interests, it also restricts the individual's autonomy.
Okay, so what is schizophrenia? So schizophrenia is a serious mental disorder that can cause psychosis and significant disability, impairing a person's perception of reality. It's important to note that while psychosis and schizophrenia are often used interchangeably, they are not the same. Psychosis is a symptom, whereas schizophrenia is a condition that may or may not include psychosis. For a diagnosis, the DSM-5 and the ICD under section F20 require that a patient present with at least two symptoms for more than a month, with one being a positive symptom. These symptoms are divided into three categories. Positive symptoms are symptoms that schizophrenics display that healthy individuals do not, like hallucinations, delusions, and disorganized speech or behavior. Negative symptoms include the absence of normal functions such as anhedonia, apathy, and emotional blunting. And cognitive symptoms include difficulties in processing information and focusing attention. So, what's the pathophysiology? The underlying cause of schizophrenia is dopaminergic dysfunction, particularly in the mesolimbic and mesocortical pathways. Increasingly, literature is now suggesting that the associative striatum of the nigrostriatal pathway may misalign salience, meaning the brain prioritizes unimportant stimuli while ignoring significant ones. This could explain the development of positive symptoms like hallucinations and delusions. So we're going to use John Nash as a case study. So a well-known example of schizophrenia is John Nash, the esteemed mathematician from the mid-1900s. He suffered from paranoid schizophrenia, which had a profound impact on his work, family, and personal life. So we're going to be looking at the film A Beautiful Mind, which portrays his experience, although certain aspects were dramatized.
So we'll just give a brief synopsis. So John Nash arrives at Princeton as a graduate student in 1947. He faces social difficulties, but begins developing his famous game dynamics theory. So later he secures a job at MIT and believes he's been employed by secret intelligence. So his paranoia and delusions escalate, eventually leading to him believing he's been hunted. So his wife Alicia contacts a psychiatrist, leading to John's involuntary commitment at a psychiatric hospital. He's subjected to insulin shock therapy, which is a painful and now obsolete treatment. Upon release, John takes antipsychotic medication, which we'll go into in a minute, under close monitoring. However, due to the cognitive dulling and emotional detachment effects, he exercises his autonomy by abruptly stopping the medication, which leads to a relapse. So there's actually a safety risk at this point, as his delusions cause him to leave his son in the bath unattended. Over time, John learns to self manage his schizophrenia by consciously ignoring his hallucinations. The film concludes with him receiving the Nobel Prize, demonstrating that through autonomy he was able to live a full and successful life.
So if we have a look at the evolution of treatment, so if we first look at management in A Beautiful Mind, because schizophrenia wasn't well understood in the 1950s, early treatment was often crude and ineffective. One example is insulin shock therapy, which attempted to alter brain function by inducing hyperglycemia. While short-term improvements were observed, the long-term effects were negligible and repeated use increased the risk of permanent brain damage. Another treatment was electroconvulsive therapy, or ECT. Unlike today, where ECT is administered under general anesthesia and with muscle relaxants, the procedure during the 1950s was much less controlled. This led to severe muscle contractions, sometimes causing bone fractures, alongside other effects such as confusion and memory loss. And despite these extreme interventions, the real pharmacological breakthrough came in 1951 with chlorpromazine. As a D2 antagonist, it helped alleviate symptoms, but also came with significant side effects, including heavy sedation, extrapyramidal effects like muscular stiffness and tremors, and increased prolactin levels, which could lead to galactorrhea. The sedatory effect was particularly highlighted within A Beautiful Mind. So we look at a moderate approach to treatment. Today, early intervention is key, with the NHS aiming to treat 56% of patients within 2 weeks of diagnosis. So, schizophrenia medications, also known as antipsychotics or neuroleptics, are divided into typical first generation antipsychotics, such as haloperidol, which are strong D2 antagonists but cause significant extrapyramidal side effects. You have atypical second generation antipsychotics like olanzapine, risperidone, and quetiapine, which act on both D2 and 5-HT2A receptors, reducing motor side effects but still carrying risks such as weight gain and metabolic disturbances. And you also have a piprazole, which is quite a unique example, as it is not a full agonist but a partial agonist at D2 receptors, making it much less likely to cause movement disorders. A few notable medications include clozapine, the most atypical antipsychotic reserved for treatment-resistant cases. It's highly effective but requires strict blood monitoring due to the risk of agranulocytosis, a severe drop in white blood cells. And also risperidone, which is the first atypical antipsychotic developed after chlorpromazine and has since been improved, with Udacity being a long-acting injectable form approved in 2023. So treatment duration varies, with first episode patients typically staying on medication for 1 to 2 years, and recurring cases often require lifelong treatment. So finally, the classification of typical versus atypical antipsychotics isn't always clear. It's a continuum, with clozapine being the most atypical and risperidone being the least.
So if we go back to the film itself, we can look at cases where patients should not be able to choose their own treatments. So for John, this is where he is involuntarily committed and treated. So first, a reason why they shouldn't be able to choose their own treatments is, or why they might not be able to, is that because of the ethical principle of beneficence. So healthcare professionals should act in the best interest of the patient and community. If a patient poses a danger to themselves or others, intervention may be necessary. So for example, John's involuntary sectioning by Dr. Rosen after Alicia's concerns is an example of this. There's also safety risks. So healthcare prioritises the greater good. John's decision to stop taking his medication led to a near fatal safety incident with his child. So patients with hallucinations could make treatment decisions without oversight. Unintentional harm could occur, like in this case. There's also case-by-case individualization. So John managed his schizophrenia without medication, but that doesn't mean that others can. So promoting and permitting schizophrenic patients from choosing non-pharmacological treatment alone might create a harmful stigma, suggesting that these types of mental health conditions can be simply thought and rationalised away. And there's also the Mental Health Act. So this legislation supports patients not choosing their own treatment in cases where they lack capacity, because it allows compulsory detention and ensures that we receive necessary care even if they don't consent. And then we'll go on to reasons why they should be able to choose their own treatment. So, for example, in the film, this is where John Nash has severe side effects and relates to his identity and his wishes. So, cases where they should be able to choose their own treatments is if there's severe side effects. So, medications can drastically impact the quality of life. So, for John, chlorpromazine caused cognitive dulling and lethargy, leading him to cease medication. So patients should be able to weigh side effects against the condition itself. There's also personal values and identity. So individuals have different life goals. So for John, he valued his intellectual abilities and his medication impaired this work. So patients should have personalised treatment options which align with their own values. Treatment's not a one-size-fits-all approach. Different treatments respond differently to different treatments. Adherence is always better when patients are involved in their treatment plan. There's also unsuccessful therapies, so some treatments are ineffective or outdated. John was subjected to insulin shock therapy, which is a painful intervention that didn't work for him. If his autonomy had been recognised, it would have avoided unnecessary suffering. And also, there's the Mental Health Capacity Act from 2005, and this reinforces that patient autonomy should be prioritised. Unlike in Nash's time, today's assessments would more rigorously evaluate whether he actually lacked capacity.
The second case study discussed as to whether patients should be able to choose their own treatment was The Father. This film explores the effects of Alzheimer's disease from the perspective of a sufferer, Anthony, using non-linear storytelling to convey the effects of memory loss. Furthermore, the impact of this disabling disease on surrounding family members and carers, for example, his daughter Anne, was a key theme. Anthony was shown to take medication for his condition throughout the film. However, this is under the supervision of carers, establishing the ambiguity and ethical debate of autonomy in this condition. Alzheimer's disease is a progressive neurodegenerative disorder and the most common type of dementia affecting memory, cognition, and behavior. Its prevalence increases with age, with symptoms often appearing in the 70s. Around 55 million people are affected globally, two-thirds of which are women. Following diagnosis, life expectancy ranges from 4 to 8 years. Risk factors include obesity, diabetes, smoking, alcohol, and genetics, in particular mutations in PSEN1, PSEN2, and APP genes. Early stages involve memory loss, impaired language, and disorientation. However, as the disease progression continues, communication becomes difficult and personality changes emerge. Anthony experienced sudden outbursts, and in later stages, sufferers become immobile and struggle with walking and swallowing. As shown in Figure 1, Alzheimer's is a proteopathy caused by amyloid beta and tau aggregation. Initially, cholinergic neuron loss in the hippocampus and basal forebrain leads to cognitive deficits and short-term memory loss, with the past and present blending in the film. Acetylcholinesterase inhibitors are widely used as the first-line treatment for AD and show a dose-dependent improvement in the symptoms of Alzheimer's by interfering with acetylcholinesterase. Tacrin, donezepil, and rivastigmine are commonly administered, and adverse effects experienced by patients may include gastrointestinal pain, nausea, dyspepsia, and skin rashes. In The Father, Anthony is shown to take medication, likely an acetylcholinesterase inhibitor, although the Standing Medical Advisory Committee recommends withdrawal of the drug in the absence of a clinical response. Secondly, memantine is an uncompetitive NMDA receptor antagonist and functions by normalizing glutamatergic transmission, neutralizing toxicity, and protecting neurons against glutamate-mediated excitotoxicity. In rat models, there's been shown a marked reduction in cholinergic cell loss in the hippocampus and basal forebrain. And in clinical trials, these favorable results modified the decline in cognition and behavior, with transgenic mice showing improved performance in the Morris Award domains. However, the use of this was limited by adverse effects such as hypertension, dysnopia, and dizziness, and is therefore only recommended by NICE when acetylcholinesterase inhibitors are not tolerated. Throughout The Father, Anthony exhibits symptoms of psychosis, including delusions, hallucinations, and disordered thoughts. In particular, the patient is shown to make up scenarios, accuse others of theft, and experience visual hallucinations involving family members and care workers. Atypical antipsychotics such as risperidone are often prescribed to treat behavioral and psychological symptoms of dementia, BPSD. However, their use is often controlled to regulate extrapyramidal side effects. This may include Parkinsonian symptoms such as bradykinesia, alkinesia, and muscle rigidity. It could be suggested that Anthony has been prescribed antipsychotics, having exhibited bradykinesia and a Parkinsonian gait, particularly when the disease has progressed later in the film. Next generation antipsychotic agents such as pimavanserin are currently under evaluation. Two main strategies dominate Alzheimer's research at the moment, including amyloid beta and tau-based hypotheses. Amyloid beta research includes humanized marine monoclonal antibodies like bapineuzumab and aducanumab, currently in phase 3 trials. As shown in Figure 4, targeting aggregated amyloid beta can reduce plaque formation. Furthermore, beta-secretase inhibitors targeting BACE have shown poor efficacy in trials. Targeting tau may offer a promise through stabilizers like epitholin D and aggregation inhibitors like REMBA. While these approaches address Alzheimer's pathology, targeting neuroinflammation, a key feature of disease, is another avenue. However, small molecule inhibitors of microglia such as alzamed and NSAIDs have failed in trials. Ultimately, improving cognitive function could ease the burden on caregivers who were shown to sacrifice their standard of living for Anthony.
So, why should patients not be able to choose their own treatments? There are several reasons. Let's go through each of these in turn. Firstly, Alzheimer's disease is frequently associated with cognitive impairment, affecting thinking, memory, and judgment. This may prevent patients from making fully informed decisions about their treatment. In the father, Anthony's reality becomes increasingly fragmented, involving psychosis. He occasionally forgets information such as his own daughter's name, as well as if he needs to take his medication. This may lead to inconsistencies in his care, raising concerns about whether patients with similar conditions can assess costs and benefits for their own health. Secondly, patients may be oblivious to or refuse their condition. Throughout the course of the movie, Anthony becomes increasingly unaware of his needs. Many Alzheimer's patients do not fully accept their diagnosis, experience mood swings, and may resist medical intervention. If they choose no treatment or ineffective alternatives, their condition may deteriorate faster. In addition, conditions like Alzheimer's tend not to only affect the patients, but also the people around them. For example, Anne and carers including Angela and Laura have struggled to manage Anthony's condition over time. Similarly, allowing patients full control over their treatment could place additional strain on caregivers and family members who must manage their health or safety. This can also create challenges for medical professionals. Furthermore, patients often assess treatments based on subjective experience rather than medical evidence. If they perceive side effects as worse as the benefits, they may stop treatment altogether, even when the medication is helping slow disease progression. Contrastingly, if patients develop dependence to a drug that has low adverse effects but not the best medical outcomes, this may lead to long term worsening of health without the patient's knowledge. Lastly, patients may not always wish to act in their best interests. Not only in Alzheimer's disease, but in other conditions such as depression and schizophrenia, mood disturbances are common, which may lead to patients struggling with thoughts of self harm or suicide. Some may engage in self destructive behaviors, including neglecting medication or choosing harmful treatments that risk overdose. This unrestricted treatment choice could enable decisions that worsen the condition, leaving patients worse than they were before treatment. But of course, there are also reasons why patients should have control over their treatments. Mainly, patients have the right to make decisions about their own health and bodies, which align with the principle of autonomy in medical ethics. In The Father, Anthony struggles with losing independence over his life, so giving patients some level of choice in treatments can ensure that their opinions are considered in medical decisions. In addition, having a choice can maintain emotional well being. Diseases like Alzheimer's can be distressing, involving a progressive loss of control over one's life. In The Father, Anthony struggles with feeling a loss of independence or interpreting his carer's supportive actions as condescending. This highlights the importance of allowing patients control over their treatments when possible, minimizing psychological stress and helping to gain back independence. Moreover, there is a major issue with compliance in many medical conditions, including Alzheimer's, which may link to the awareness or denial of their state mentioned previously. Although Anthony does not directly refuse medication in the film, he experiences frustration when offered to be put into a new care facility. So, if patients have a say in their care, they may be more willing to follow their treatment plans consistently. Finally, individuals will often respond differently to varying medical treatments. Interventions differ in terms of effectiveness, side effects, and tolerance. As patients obtain first-hand experience on the effects of their medications, they may have preferences for certain interventions than others, as they know that they can tolerate these better. Medical professionals may not understand the impact of each medication to such a personal level, highlighting the significance of letting patients choose their own treatments.
So, just to conclude, we can obviously see that this is a complex issue governed by legislation such as the Mental Health Act and the Mental Capacity Act of 2005. So, A Beautiful Mind illustrates both the loss and regain of autonomy in the mental health treatment. However, it does raise an important question, and was enough done in the first place to determine John's true capacity to make informed decisions. So we argue that in modern times, a more thorough capacity assessment would have been conducted, potentially allowing Nash greater control over his treatment from the outset. The Father also illustrates the challenges of Alzheimer's disease, where cognitive decline, confusion, and resistance to treatment can make independent decision-making difficult. This creates the same ethical dilemma between balancing autonomy and ensuring beneficence. Healthcare professionals should ensure working alongside patients to ensure and create a care plan which benefits the patient health and wishes.